So thank you for joining us today for our Blue Cross Behavioral Health webinar. My name is Kelly Nierick. I'm the Director of Products and Services with the Small Business Association of Michigan. And May is Mental Health Awareness Month, and Blue Cross Blue Shield of Michigan wants to ensure that small business employers have the information they need to promote available mental health resources to their employees. Which is why we worked in partnership with Blue Cross to provide this webinar to you and additional tools and resources that you'll be able to access. So I would like to introduce Sarah Linville, who is the Manager of Chamber and Association Engagement with the Blue Cross Blue Shield of Michigan.
Awesome. Thank you, Kelly, and welcome everyone. At Blue Cross, we are very appreciative of our long-standing partnership with SBAM, and we are super glad that you could join us today. We are excited to be able to share this content with you, and we do hope that you will find the information to be a valuable resource for both you and your workforce, especially as we head into the month of May, Mental Health Awareness Month, as Kelly mentioned. Just a few housekeeping items before we do jump into the content. We do want to hear from you today. However, we'd appreciate it if you could keep your mics muted, but you can utilize both the chat function or the Q&A function to submit any questions that you have, and we will address those at the end of the webinar this morning. In addition, just to encourage a bit of participation in today's webinar, we will have a few polling questions posted throughout it, so please feel free to respond to those. With that, I would like to introduce Shalini Khandelwal, Director of Behavioral Health Strategy, who will be discussing Blue Cross's advanced behavioral health capabilities that prioritize member well-being, streamline care coordination, and drive positive outcomes. In addition, we will be reviewing some resources with you today that will help you promote these various programs with your workforce. Ultimately, we want to ensure that both you and your employees have access to all of the wonderful behavioral health resources available through Blue Cross. Shalini, I will turn it over to you.
Thank you, Kelly. Thank you, Sarah. Very happy to be here today. Again, happy Mental Health Awareness Month. There is a lot that we're going to be covering today in terms of resources for your members. So looking forward to the discussion, and we can move to the next slide. So this really encompasses what we'll be talking about today, behavioral health as an umbrella, and under that umbrella falls mental health disorders as well as substance use disorders. So we'll spend some time talking about, what exactly those are, and then what, programs, resources, initiatives that we have in place at Blue Cross to ensure that your members, ensure that our members get the care that they need when they need it. So, as Sarah mentioned, we have a polling question. Should be able to see it. Within the past year, have you been made aware of someone within your workforce that needed support for a behavioral health concern? So, if you can provide your response. Okay, so we got about 67% that said yes, and 33% that said no. This is very in line. We are hearing more of the, higher prevalence of behavioral health disorders. So we'll talk about that here shortly, but very, common within even the workforce. So that resonates with what we're seeing across the board in terms of behavioral health concerns within the workplace. So from the slide here that's on the screen, I think we all know that prevalence of behavioral health disorders is on the rise. We can see it in the numbers. These are some national and Blue Cross Blue Shield of Michigan specific trends around behavioral health. Unfortunately, with the pandemic, we are seeing double-digit increases in behavioral health diagnosis prevalence. across the nation, as well as in our own member population. So a few specific trends that I would like to call out: the 55% of Americans with a behavioral health condition receive no treatment. So whether that is driven by stigma, lack of providers, this is really one of the main pain points that Blue Cross is trying to solve for. Making sure that we're increasing access, encouraging members to seek routine therapy, just like members have established primary care relationships for their physical health. We want to, getting established behavioral health care is just as important. And then why the sense of urgency and really why this matters. We also know that one person dies by suicide every 6 hours in Michigan alone. So this is the reality. We have to continue to do better, improve access, and reduce stigma. So Blue Cross Blue Shield of Michigan has made it a priority across the enterprise with corporate goals to ensure that we meet our members' behavioral health needs. The pillars outlined here, as you see on the screen, demonstrate the foundation that we are building to ensure success. So a lot about what we'll talk about today fall into these respective categories. One, access to care. We want to continue to find ways to enhance our provider network, expand virtual care options, provide care navigation, expand crisis services. So different avenues of care. We want to make sure members have access to those. Not only do we want to improve access, not only do we want to improve access, but ensure we have levers in place to monitor quality of care. So ensuring that that care is high quality and high value. Specialized services for members that need it, such as care management and tailored resources based on member-specific needs. Self-management tools, we want to ensure that members are well-equipped with resources to manage care on their own when they don't necessarily need professional psychotherapy. So we'll talk about some of those digital tools here shortly. And then lastly, we cannot do this alone, ensuring that all members have equitable access to care, to reduce healthcare disparities. We're developing some of those partnerships with the community health systems to improve outcomes. We will talk about resources available to members in all of these different categories, and where applicable, as Sarah mentioned earlier, the slides have embedded links that can provide more details on, flyers, different resources, and more information on those resources for your members. So we inform our strategy based on member feedback and ensuring that, we're addressing barriers to care, access, stigma, quality, and cost, and providing solutions that address all parts of the behavioral healthcare continuum. So I would say if there's one slide that describes our portfolio very well and all of the different levers that are in place, it would be this one. As we find ways to deliver behavioral health care to our members, we must recognize that it is not one size fits all. So this gives you a high-level snapshot of how we're striving to address member needs and be market leading and have continue to expand our solutions, provider network, services, and address care across the entire continuum. So if you move from left to right on this slide, you'll see that there's low risk and rising risk. That's where we're supporting our members' needs via resiliency tools, self-management, access to psychotherapy, access to virtual care, member engagement campaigns, integrated care avenues, and care navigation. We're continuing, as I said, to find ways to enhance our provider network, increase those access points for our members. And then for the high risk and acute risk, that's where we have care management and crisis services to provide more additional support for serious and more critical needs. So we'll be discussing some of those enhancements shortly. But before that, we have another polling question. How confident are you that you would know how to access the behavioral health resources available to you through your health plan or employer? So you can take a few seconds to respond. So the responses show mainly slightly 60% of respondents said slightly confident, and then 40% said fairly confident. So really good to see fairly confident, slightly confident, very common. Sometimes we see not confident at all. It is very hard to navigate the healthcare system, what resources are available. So I'm hoping that, after we talk through all of the different resources, where things are located, we can raise the confidence level for you to be able to provide resources for your members. So we'll go into the first pillar, ensuring access to care. So one of our key priorities when it comes to behavioral health care, as mentioned, is access. We know that there's a mental health provider shortage across the nation. Demand is continuing to rise, but we're trying really hard to increase the number of access points for members, including virtual care, crisis expansion, care navigation. So we have seen a pretty significant increase over the past 2 years, especially driven by the pandemic, where we have increased provider access points, member access points, whether that be virtually or through care navigation. And we are hoping that these trends continue, where we can continue to grow our network. So what type of virtual care options are available? These next few slides provide detail on the different avenues to virtual behavioral health. In partnership with Teladoc Health, virtual care is an option for members to receive behavioral health services conveniently from their own home, and can be used for a wide range of mental health conditions. One key differentiator with this program is it is available, the therapy component is available for members 13 plus. So it's very good that dependents, we have, for the teenage years are able to utilize the service. Care is also available for more complex and serious mental health conditions via the psychiatry and medication management. This service is very beneficial for members that are traveling, live in rural areas, have narrow provider networks, and just need greater access to behavioral health care. And also it's, kind of the value proposition around this is that it allows for members to establish a long-term relationship with a therapist or psychiatrist. As mentioned, there's a link at the bottom of the slide to learn more, or provide flyers to your members on this resource. So we've also expanded access to national virtual providers via Able2, and it's expanded our network by about 2,500 plus therapists across all 50 states. So this is slightly different than what the virtual care component that we just talked about. This is strictly therapy. It's a structured 8-week program for members 18 plus. It's predominantly for the treatment of anxiety, depression, and stress. This program really provides a more personalized care plan for members based on their needs, and it's more beneficial for members who, need the guidance of a licensed therapist to help them with their depression, anxiety, stress symptoms. But then it's also for those that, in conjunction with that therapy, they get practice sessions, and they have the time to, actually work on modules and different components through this program across those 8 weeks. This program does not offer medication management. Again, it's more strictly just 8 weeks of therapy. So this kind of relates to our polling question earlier about, how do members know where to go? Do we even know what resources are available? As a result, we know that navigating the behavioral health system can be difficult and complex. So to solve for this, we launched a partnership with, pretty recent, it hasn't been a full year yet, but launched a partnership with Quartet Health, which is a care navigation platform to not only ensure that there is access to care, which is kind of what we talked about earlier, but also that speed to care for a member is within a reasonable time frame. So this is for our Michigan fully insured members. At a high level, members complete an assessment, a self-assessment based on, this is what I'm looking for. They get matched with a appropriate provider within a timely manner, and ultimately get access to care when they need it. So in a short time, we've seen high traction and utilization, which has been driven by our member engagement campaigns, letting know members that this is available. And there's been about 1,400 members utilizing this to date. Like I said, this is really, sometimes we hear, okay, the access is there, but, I'm being told that it takes 4 weeks or 6 weeks or 2 months to get in to a provider. This is where this program really ensures that speed to care is within, 10 days or 8 days, whatever is most reasonable for the given symptoms, and then also location of the provider and member, and just mainly to ensure that members are seen within a timely manner. So we also need to ensure that there's access to urgent and crisis care needs for our members. So what we talked about earlier is more of that low risk and rising risk, but when we move into more of the acute risk and crisis needs, we are continuing to develop and expand crisis services in Michigan. So we've expanded access via these 4 main avenues of care that you see on the screen. So we have psychiatric urgent care that is more so an urgent walk-in service. We have mobile crisis. These are mobile units that can be deployed to the home, office, emergency room for immediate intervention. We have crisis stabilization, which is a place to go for 24/7 recovery for urgent and emergent situations. And then we have crisis residential. That's more for short-term treatment, a place for recovery. So since implementation, we have seen some promising early outcomes in that more than 50% of members at these centers have been directed to less acute settings. And really the goal of these types of programs is, instead of members going to the ER, we believe that these types of settings are more appropriate to address, these urgent and emergent behavioral health related concerns. We're working to expand crisis services, recruit more providers, work with, the different regions in Michigan, Southeast, West regions of the state to cover more large population areas. So our next pillar on high value and high quality care. Another initiative that has allowed for increased access and integration in our provider communities is leveraging the collaborative care model. So we know that for many, their first point of contact with the healthcare system is through their primary care provider. This model efficiently expands the primary care team to include behavioral health services. So as mentioned earlier, we know there's a shortage of mental health providers. So this is a great way and more efficient way to allow for more coordination of care within the primary care setting. So high level, some progress points. We have providers from over 239 practices that have been trained to deliver this type of model. And we're, due to the success thus far, we are working to expand it to different specialties. Members can find the designation as co-CM. They can find that in the Find a Doctor tool and be able to, see if their primary care provider provides that service. As substance use prevalence continues to rise, this is another area where we are focusing. So on the left side of the screen, one way is through medication-assisted treatment. This is really to address a lot of the opioid overdoses that we're seeing. According to the CDC, there were over 80,000 overdose deaths in the past year. So as a result, we have continued to expand our medication-assisted treatment intervention. This is evidence-based, effective in the treatment of opioid use disorder. And since initiation, there's been about a 78% increase in providers across the state of Michigan, kind of denoted by the map on the bottom left. And 66 counties have, currently 66 counties have PCPs delivering treatment. On the right, we also have a national program, our Blue Distinction Specialty Care for Substance Use Treatment and Recovery. These facilities are recognized for quality and value-focused care. Still growing, but as denoted by the map on the bottom right, there are over 380 facilities in 42 states, and we're continuing to expand there as well. Pharmacy integration. So it's really important that our overall behavioral health strategy focuses on holistic health. And one component of that is pharmacy integration. So having your pharmacy benefits through Blue Cross Blue Shield of Michigan ensures that we can provide more of that holistic behavioral health treatment. So we have initiatives in place. These are some of them listed on the slide, such as incentives for medication adherence, diabetes screening for those with comorbid behavioral health conditions, and we do a lot around opioid management, which we'll talk about here on the next few slides. So in regards to opioid interventions, we provide various forms of member outreach when an overdose occurs. When Blue Cross learns about an overdose, there's different avenues to provide outreach for our members. We provide support and referrals to in-network providers. Where applicable, at the Blue Distinction Center that I mentioned earlier, that's a national program, as needed, we can refer our members there. We also provide education when a member recently fills opioid prescriptions. It's really important that we inform our members on the safety precautions, resources available, if dependency, how quickly dependency can happen. So we want them to be aware of the risk factors. And then most importantly, where to go if they need any help throughout that journey. So for members, as we think back to our low risk, rising risk, high risk, chronic risk, for our high risk members that require high chronic behavioral health needs, we have our Blue Cross Coordinated Care behavioral health offering. This includes personalized care management, clinical guidance. It's more for the severe critical behavioral health needs. This is one area that we've continued to evolve, and as of recent, as of just January 1st, 2024, we have revamped our entire behavioral health care management. And some of those enhancements include predictive analytics, clinical escalation and advocacy, more specialized programs, and we'll discuss some of those here on the next slide. So these are some of the newer enhancements, as mentioned, with behavioral health, not being one size fits all. We want to ensure that we're addressing all of our members' various needs. So as a result, this is more of a member-guided approach that connects members to quality care, close gaps, improve member outcomes, and access to programs like these. So we have substance use disorder, connecting members to quality care and resources, guiding members to in-network facilities. For our LGBTQ plus population, we have materials, coping skills, access to a Pride community page to provide resources for the given population. Geriatric, using social determinants of health and stigma specific to this population. We have curated education, different education modalities, and any common comorbidities that impact this population. We want to make sure that we help those members accordingly. Maternity, supporting members throughout their pregnancy journey, and providing care coordination. Eating disorder, we have seen a higher prevalence of eating disorder within the past few years. So as a result, we want to provide members with training, providers with training, as well as members with training and resources and community resources that are available. And then lastly, autism. We have a dedicated care team that consistently monitors progress and quality outcomes and provides support to families. Okay, so as we move on to our self-management tools, so what we've talked about so far, a lot of those are specific, whether that's access to psychotherapy or access to more of the higher risk programs like care management, but not everyone requires therapy. Rather, they would like some type of self-guided resources, be able to navigate care on their own. And so mental health self-guided support provided by Teladoc Health provides modules and text-based engagement to help members. And this includes cognitive behavioral health therapy approaches, coping skills, and overall development of skills to manage one's mental health. And I think I missed, Sarah, do we want to put that, or Kelly, do we want to put that polling question up? I think it's, yep. So just wanted to get some feedback if anyone's aware of this type of self-guided mental health support program and resources. Okay, so 100% we're not aware of this program, so I'm glad that we're talking about it today. I think that this is another great option for members that on their own time, they want to know what's available to them, track their care on their own. So hopefully, this is something of value to your members. And again, there is a link embedded at the bottom of the slide for you to promote this if you choose. We're towards the end. I know we talked about a lot today. Imagine having all of those behavioral health resources in one spot with easy access for members. That is a lot of what we hear is that members, there's too much thrown at them. They don't know where to go. So as of 2024, this is another enhancement. This is a new behavioral health support page. It offers more of a curated member experience. As a member logs into their member online account, they're able to complete a questionnaire to say, I'm looking for this, or I'm looking for these types of resources in terms of behavioral health. And then it'll populate on the screen on what's available to the member, and they'll be able to easily click on those resources. So we're hoping that that's at least a step in the right direction when it comes to making sure members know where to go for care. Our engagement campaigns, this is another great way that we can increase awareness, education, reduce stigma. These campaigns have been successful in directing members to resources based on their needs and self-service through our behavioral health website. So far, the focus has been around parents and children, teens and seniors, and the content is regularly optimized based on the needs of the market. So we can't do all of this alone. We have community partnerships to ensure that we are best reducing healthcare disparities. That includes communication and outreach, suicide prevention, addressing mental health in schools. So this is just some of those listed here on the screen on some of those milestones and areas that we continue to partner to ensure that we are reducing healthcare disparities. So here we just have a recap of everything that we've discussed. The link at the bottom shows different ways that you can utilize our Engage page as well as our website to provide resources to your members. Hopefully this was valuable and again, a great time to talk about it, especially with Mental Health Awareness Month. I'll pass it back to Sarah and Kelly.
Go ahead, Sarah.
I was going to say, are there any questions? Let me see. Okay. Oh, Natalie added some additional information. Are there any questions? So I know we're right at time, you guys, but if you have any questions, feel free to come off mute and ask those. If you want to put them in the chat or the Q&A, feel free. The other thing I am going to do is I will share this deck with everyone following today's session so that you have access to all of those resources that Shalini discussed. And then you can feel free to reach out to me from that email address with any further questions that you may have.
Thank you both so much. SBAM will also be sharing all of these resources on our website, which is sbam.org, as well as a recording of this webinar with the deck that Sarah's going to share. So please reach out to any one of us if you'd like to access any of these tools or resources, or if you have any questions. Thank you so much for joining us, and I hope everybody has a wonderful afternoon.
Thank
Thanks for
you.
everyone.
Thanks.
Care.